Okay, so now the Wuhan coronavirus has caused four confirmed cases in the United States. One in Chicago, one in Seattle, one in Orange County, California, which I think is the Bay Area, and Los Angeles. On top of the fact that Kobe Bryant died, apparently. But, anyways, that's not the point. The WHO, the World Health Organization, needs to call or needs to announce a global health emergency. Here's why. In only 3 to 4 weeks, a virus has wreaked havoc on one of the largest cities in the world, Wuhan, China, and caused global panic because it has a very high death rate and it spreads very, very easily. And the WHO decided not to call it a global health threat or a pandemic, or it's like a viral threat of international concern, something like that. They decided not to do that. And frankly, I'm very confused as to why. Now, I've read a lot of articles and I've read a lot into this entire thing, and I've noticed that there is more it's worse than the WHO claims it to be. I mean, the cases are just like staggering. They're so high now. You're getting 400 to 700 new cases a day, and it's only going to grow exponentially. It's just like the rise of AIDS in the 80s, honestly. Now, the WHO decided not to call this international health threat, but now it's spread to 15 countries and has caused 60 deaths. And I don't think that would consider it. I don't think you would consider that one country anymore. It is 15 countries. Now, of course, I mean, it's understandable that they wouldn't have called it last week when there were only like 9 to 10 cases outside of China, but now there are like 30 to 40, and Hong Kong even has 9 cases of it now. It's very, very outrageous that they don't call it a global health emergency. So, for example, there have been 5 global health emergencies announced within the last 10 years. But one of them was the rise of polio in, I think it was Africa, or it was Afghanistan, something like that. It was in either the Middle East or in Africa. But also remember, this only caused there were only 266 cases of this. Now, if you look at the Wuhan virus, it has been 4 weeks, and there have been over 2,000 in one city, along with over 40 in other countries, in surrounding countries, and all the way across the globe. You cannot say that this is not a global health threat, as now it has spread to 5 continents. It is currently active in 5 continents, and we have had our first report on Africa. So the only continent remaining without there are only 2 continents remaining without an actual, case, and that is Antarctica and South America. So obviously this is very difficult for the WHO, as this is a threat, a huge threat. I think the WHO needs to act immediately and call out a global health threat, because even though panic will, of course, ensue, because I mean everyone's gonna be like, oh, it's a global health threat, we're gonna lose our lives. They'll be able to counter it with international support. It won't be just China going after it like crazy. It'll be every country, every superpower in the world fighting a torrential disease. Now, it's very important that we get it done in the early times because, I mean, this is a virus that has an ability to kill 65 million people in 18 months. It is time that we act. We must act now. We don't have an option to act in 3 months. We only have an option to act now. So that's all I can really say. I mean, it's very peculiar to me that they haven't called an emergency meeting on this yet. I mean, they said they reconvene on it, but it hasn't occurred yet. So I expect that they will announce it to be a global health emergency within the next week, if not even earlier than that. But I mean, as of now, China is isolated from the world, especially the Hubei province. So I wish them the greatest of luck, and I wish humanity the greatest of luck.